Could one blood test detect 50 plus cancers? It sounds almost impossible, doesn't it? But this technology is real. It's called multi-cancer early detection, or cool people call it MCE. And it may represent one of the most fascinating developments in cancer detection. But before anyone calls this a miracle test, there's something extremely important we need to know. And as you know, I'm Alex Ehsan. I'm a hematologist, oncologist, and I do internal medicine as well. I want everyone to know that, in my opinion, this is not a proven test that can tell you with certainty whether you have cancer. And it does not replace cancer screening tests that we already know save lives. Some cancer cells release tiny fragments or pieces of the genetic material in the bloodstream. Newer blood tests can analyze the pattern in that material, such as changes in the DNA methylation, and look for a signal that may be associated with cancer. With a single blood draw, some of these tests are designed to look for signals associated with dozens of different cancers, more than 15 something. Some of these cancers that are being investigated do not currently have routine screening tests for the general population. As you know, I do videos on many tests, on many cancers that don't have a routine test. Then, think about cancers such as pancreatic, liver, ovarian, esophagus cancer. We desperately want better ways to find some of these cancers earlier, especially me. So, does that mean everybody should get this test done? Answer is no. And this is where we need to separate excitement and evidence. A positive cancer signal does not automatically mean that you have cancer. It may lead to additional blood tests, CAT scans, MRI, endoscopy, biopsy, expense, and there's no cancer found at the end, and ultimately anxiety and mental health. And the opposite problem is just as important. A negative result does not guarantee that you are cancer free. A cancer can still be present even when the blood test does not detect a signal. So these tests can have false positives, they can have false negatives. Their performance varies by the type of cancer and by the stage of the disease. And most importantly, we still need high quality clinical evidence really to determine exactly how much these tests improve outcome and whether using them broadly actually reduces death from cancer. So please remember, do not skip your mammogram because of a blood test or your pap smear or your colonoscopy. Do not ignore your lung cancer screening, and never ignore a persistent concerning symptom. You got to talk to your doctor. Weight loss, unexplained, abnormal bleeding, lumps that don't go away, pain, difficulty swallowing. Then again, I'm an oncologist and I find the science behind multi-cancer detection incredibly exciting. Could this technology eventually change how we screen for cancer? Possibly. Could it someday help us find certain cancer earlier when treatment may have a better chance of success? I sure hope so. But hope and scientific proof are not the same thing. So right now, I would describe these tests as promising technology with important limitations, not a cancer detecting miracle. Medicine advances because we ask difficult questions and we test new ideas and then demand good evidence before making extraordinary claims. But are we there yet? The answer is no. And the distinction matters. Have a blessed day, and I hope we cure cancer one of these